at international conferences, including International Association of Nigeria in Northern Africans, Nigerian Nurses in Northern Africa, NANNA, scientific conferences, in 4th and 5th Africa Annual Global Health Conference, a North Cameroonal Conference of 2024-2025 respectively. He is also certificated. He also has a certificate participation, in public health training program organized by the World Health Organization, WHO, Harvard Medical School, London School of Hygiene and Tropical Medicine, United States. Reflecting his commitment to lifelong learning and global best practices, with strong leadership, mentorship, and a research-driven approach, Dr. Timothy Agogo Ehwarieme remains a forefront as transforming nursing education practice and bridging traditional and in broad healthcare system. Ladies and gentlemen, with a loud applause and a standing ovation, I humbly present to you today
the Pro-Chancellor, the Vice-Chancellor, every other protocol duly observed for what of time. I want to say I'm very happy, I'm so elated for this invitation. And I want to thank the university management who has made this possible. Also extending my appreciation to the acting dean of the Faculty of Nursing, as well as the HOD. I want to say I am not taking this for granted. I'm so much, very much grateful for the invite. Thank you, and God bless you. I still want to say this, that since I arrived yesterday, the care has been top-notch, and that makes me to validate that saying that the Yorubas are very caring. I have witnessed it, and I have tasted it, and I'll continue to taste it. Thank you very much, Pro-Chancellor. Thank you very much, Vice-Chancellor, for making this very, very possible. Now, going to the business of the day, we have before us a very important topic, which has to do with preventing acute medical emergency in the community, strategies for reducing stroke, heart attack, and chronic disease complication. We have this objective. But look at this picture before you. What can you mirror from it? You see the one on the left side, and you see that on the right side. What does it depict? What can you relate? How can you relate with it? Now, before we go on, we have some case scenario. Unfortunately, I think the words are very small. I don't think I can be able to. Okay, let me read it from here because it's very, very important. The first case scenario here is a 56-year-old man with his while at home. His family assume he is tired and decide to observe him. 4 hours later, when his condition worsened, he's finally brought to the hospital. By then, the window for effective reperfusion therapy has closed, and this man was left with permanent disability. The man was left with permanent disability. There are other case scenarios that has happened, even within us, among our family. That speaks so much of what we are about to say today. I'm sorry, this slide I don't think I can really, please can you get my laptop? The projection is that poor that's to be difficult to see what we have here. I'm sorry for the time. I'm so sorry. I didn't expect it to be like this. So, what is acute emergency? Or what is acute medical emergency? Acute medical emergency are sudden, severe, potentially life-threatening conditions that require rapid recognition and timely intervention to prevent death or long-term disability. And this acute medical emergency, they arise respiratory, even metabolic and traumatic cases. And they constitute major driver of emergency healthcare utilization globally. Their effective management or effective care depend on early recognition of the warning signs, prompt diagnosis, and timely initiation of care. Timely initiation of evidence-based intervention, also with coordinated multidisciplinary management. However, if this is delayed, it might result to serious complication, which is some of the things we find. Apart from the serious complication it might result to, it might also lead to long hospital stay, and that will be very costly for us. To result to long hospital stay, it can also result to poor prognosis, as the case may be. Now, when we talk about this acute medical emergency, what are they? We have things like cardiovascular disorder, for example, heart failure. We have things like stroke and heart attack, or what we call myocardial infarction, or sudden cardiac arrest, which are the two main focus of this lecture, in addition to other chronic disease conditions. In many cases, in many situations, you would have heard that I just saw a man yesterday, I was with this man yesterday, and the news came that in the evening, after closing from work, he just shouted, my heart, my heart, my heart. I'm having pain, I'm having pain. And that is just the end. Things like my eyes, I'm feeling dizzy. I can't see very well. I can't see very well. And before you know, this person slumped. And that is the end of the story. Now, you see that there's a continuous growth in the number or level or prevalence of this acute medical emergency. Globally, 17.9 million deaths occur annually worldwide that result from cardiovascular disease. And this burden of death is high in low, medium income countries like Nigeria. Particularly in Nigeria, majority of this acute emergency is said to be caused by hypertension. Hypertension has been identified as a major modifiable risk factor. For hypertension has account to 13.2% of myocardial infarction, which we can also relate to sudden heart attack. Then 24.6% of stroke, either ischemic stroke, which amount to 21.6%, or intracerebral hemorrhagic stroke, which amount to 33.1%. So in all, you find out that hypertension has been a great implicator or factor in acute medical emergency. And the worst of all, hypertension does not give any sign. As you are sitting down here, we might be sitting with hypertension, but we are very happy. We are very active. We are doing all we are doing. It's not like fever. It is not like other type of sickness that probably will manifest in one form of sign or the other. And that is why it was given the name, the silent killer. Before hypertension gives you sign, it has resulted to complication. And what are those complications? Those complications could result in stroke, or it could result in heart attack or sudden cardiac arrest. Stroke is said to be the leading cause of non-communicable disease mortality in Nigeria. Hospital studies have shown that ischemic stroke accounts or amount for more than 2/3% of admissions, and the case fatality is very high, up to 23%. And in Africa accounts for 90% of global stroke burden, and with annual incidence of 316 per 100,000, with a prevalence of 1,460 per 100,000. And studies have also shown that there is a lifetime risk, and in 4 adults, 1 might suffer from stroke. That by the end of 2030, there will be 80% of new cases of stroke. Collectively, this data demonstrate a substantial and escalating burden of acute medical emergency, either stroke or sudden cardiac arrest. And there is need for us to be very vigilant. There is need for us to pay serious and conscious attention to this silent killer. Like I said, hypertension is one of the major modifiable cause of stroke, major modifiable cause of heart attack, and it does not give warning. Now, another cause of acute emergency is CAD, which is coronary artery disease, is the leading cause of also sudden cardiac attack. And that coronary artery disease is linked to a rising hypertension. It's also caused by hypertension. It's linked to diabetic and also dyslipidemia. And studies have shown that by 2030, 23.6 million global cardiovascular deaths are expected. And this will occur in low-medium income countries such as Nigeria. So the key message here is that uncontrollable hypertension and modifiable risk factor drive escalating acute emergency condition. Therefore, there is need for population-level prevention. There is need for early detection, and there is need to strengthen acute care. Now, let's understand some of these factors, because we have heard hypertension, we have heard stroke, we have heard sudden cardiac arrest. Now, what are the risk factors? Because there is a saying that when problem is known, it is half solved. The problem is half solved. What are the underlying risk factors? Some of these risk factors will be our focus and our target to watch out for, and that will help us to able to recognize some of the signs and symptoms, as well as taking early intervention. Acute medical emergency, particularly stroke and myocardial infarction, are largely influenced by the modifiable risk factor, which I mentioned earlier, that is hypertension. Chronic high blood pressure accelerates atherosclerosis. They also damage blood vessels and increase plaque rupture. And it is rupture of plaque in the brain that leads to stroke. Then the atherosclerosis, or damage of blood vessel by the plaque, that leads to sudden heart attack. Another factor is hyperlipidemia. Hyperlipidemia is a situation where there is high cholesterol and triglyceride. When these plaques are formed, they clog the artery. They clog the lumen of the artery such that the blood cannot supply the nearby organ. And let's assume this occurs so much in the coronary artery, because the coronary artery, they are tiny, just as we have in the brain. Now, when this plaque clogs the coronary artery, it therefore means that blood cannot be supplied to the wall of the heart, and that will lead to ischemia. From ischemia, it produces slump and die. Now, this thing does not happen immediately. It is something that has been going on in the body, but we did not know. We could not recognize some of the signs and symptoms. And because our way of life and how we take things also have a large effect on how we perceive some of these signs and symptoms. Another factor we should look out for that can increase the risk of this acute medical emergency is diabetes. Now, diabetes is a chronic disease that is ravaging a whole lot of people. Now, when I was growing up in the school, we were taught that diabetes is the mother of all disease, while hypertension is the father of all disease. Why? Because once you have diabetes, there is tendency that almost all the disease will come if you are not careful, if you are not adhering to your treatment. It has the capacity to attract every other type of disease. Name it stroke, name it cardiac arrest, name it nephropathy, name it anything you think. That is why it's mother, because we believe that the mother is capable of taking care of everybody. So that is why it was nicknamed mother of all disease. So it can take care, it can cohabit with every other disease in the body. Another factor again is smoking and alcohol. And this is very, very important. Smoking and alcohol. We have cigarette smoking. Smoking has been attributed as independent risk factor for myocardial infarction and ischemic stroke. Why is it so? Now, cigarette has some chemical. Among those chemicals is nicotine. The nicotine and tobacco in cigarette causes endothelial injury. That is, they destroy the wall of the artery. And they also increase platelet aggregation. All these things will lead to vasoconstriction. And when they vasoconstrict, they hold the tendency of blood to be supplied to distant organ or nearby organ. And let's assume this happened in the brain. What happened? There is no blood supply to the brain. And if the brain lost blood supply, the brain cell die, and that lead to ischemic stroke. Any part, that part of the brain is controlling the body become paralyzed. So also with myocardial infarction, if the result happen to go to the heart. So cigarette smoking is very, very dangerous. Alcohol is also very dangerous. Alcohol, chronic heavy alcohol or use of alcohol can increase blood pressure and also become a major risk of stroke and heart attack. How does it work? Drinking alcohol profusely can increase sympathetic activity. There is a sympathetic nervous system. And you know what sympathetic nervous system that makes us very active. And that's what causes vasoconstriction. And once there is vasoconstriction, what happens to the vessel? There will be resistance to blood flow. And that resistance generates a pressure that leads to high blood pressure. Once that resistance is there, the body assumes that there is no fluid in the body. So what happens? It activates the renin-angiotensin system. And that will lead to fluid retention again. And fluid retention in the body is building up the blood volume. That will also lead to blood increase in blood pressure. Apart from that, some chemicals also, some of the elements in the alcohol can also damage the vessels and cause what we call oxidative stress. Studies have shown that heavy drinkers have significant higher BP than non-drinkers. Another thing that alcohol can cause is what we call atrial fibrillation. Atrial fibrillation is a condition where we have that the heart is beating irrationally. And that irrational beating cannot supply the adequate blood that is needed by the body. So your heart is beating, but it's not carrying enough volume of blood to the body. So what happens? The person becomes weak. There is unusual fatigue and no slowness, and before you know, the person can faint or collapse, as the case may be. Apart from that, why does it cause that atrial fibrillation, which I said is irrational heartbeat? The heavy drinking have a way of what we call causing electrical remodeling of the electrical activities of the heart. And that leads to abnormal conduction and arrhythmia. Arrhythmia is one of the cause of sudden cardiac arrest. When the heart is beating so fast, and yet it's not carrying enough blood, the body signals the heart to beat more. It will get to a time the heart will get tired. And when the heart gets tired, what happens? The heart will collapse. And we say the person has heart attack or cardiac arrest. Evidence have shown that hospital study, there is 3 to 5% higher atrial fibrillation prevalence among heavy alcohol users compared to the general population. There are also what we call alcohol cardiomyopathy. So you can see that alcohol is a significant modifiable condition for this acute medical emergency, whether you call it stroke or you call it heart attack. Alcohol can cause the heart to enlarge. And how does it do that? The toxic effect of the alcohol, for example, the ethanol in the alcohol and the acetaldehyde in the alcohol, can cause myocardial cell death, can cause the cell of the heart to die. And when it dies, it becomes fibrous. It therefore means that the heart can no longer contract. And inability of the heart not to contract will lead to cardiac arrest. And it can also cause what we call mitochondrial dysfunction. And you know that the mitochondria is the seat of energy production. And what happens, there will be reduced energy production and alter constant handling, which will lead to decreased contractility. All these consequences I've mentioned make alcohol to cause dilated cardiomyopathy that reduce ejection fraction as well as heart failure. And all this also increase the risk of myocardial infarction and sudden cardiac death. So all this put together, you see that excessive alcohol intake contributes to hypertension, atrial fibrillation, cardiomyopathy, creating a cumulative risk for stroke and myocardial infarction. Another cause of this acute medical emergency is sedentary lifestyle. Now, because of globalization, or let me say because of civilization, we are now becoming sedentary in our lifestyle. There is inactivity. The physical inactivities has increased the risk of cardiovascular disease because inactivities can lead to obesity. And obesity, when one is obese, it causes insulin resistance. And when there is insulin resistance, therefore means you are heading to diabetics. And like we said, diabetes is a mother of all disease because diabetes can cause plaque formation, deposition of a plaque in the wall of the artery that can also lead to either stroke or heart attack. Then we have hypertension. Then we have dyslipidemia. Poor nutrition. What we eat these days, we just eat for satiety. We don't eat because our body needs it. We eat to make us have the sense that we have eaten and we are full. But what have we ate? What is it that we took in? So poor diet is one very factor. In fact, when you talk about cardiac arrest, when you talk about stroke, you cannot rule out poor diet. We eat junk food in the name of food. Now, we don't cook our food again. We go to the eatery to buy snacks. Snacks that is made up of salty ingredients. It is sweet and very high cholesterol. Now, let me tell you, cholesterol is a sweetener in food. If you cook your food, there is no oil, you cannot eat it. So that tells you, cholesterol is a sweetening agent. Oil, fat is a sweetening agent. And because it's a sweetening agent, we want our food to be filled with oil. And that is indirectly ingesting cholesterol. And cholesterol has a way of building up in the body and causing stroke because it will lay on the wall of the vessel, and some of them will rupture to cause stroke, and some of them will block the supply of blood to cause sudden cardiac arrest. Obesity, I've mentioned. Inactivities can cause obesity. Whether central obesity or abdominal obesity have been linked to hypertension, diabetes, dyslipidemia, inflammation, and all these are cascading the event of acute emergency. It has been shown that there is a rising obesity in women and adults of 35 to 65. And this rising obesity has been correlated with higher stroke and myocardial infarction rate in Nigeria. Stress is also a very important factor. We work, yes, we want to hustle, but how often do we give ourselves to rest? We don't rest because we want to make money. The country has made it difficult for us to rest because we want to make money from different places because of the harsh economic condition. But today, we should know that we need rest. Stress is a chronic factor that can trigger myocardial infarction. Why is it so? Stress raises the level of catecholamine in the body. And catecholamine is connected with sympathetic activity that can lead to hypertension and endothelial dysfunction. So we need to rest. Give your time, space, time to rest. What about sleep? Many of us don't sleep. We leave the work, we come to the work in the morning, we leave in the evening. When we get to the house, we continue with our work. Maybe we can't sleep by 12, we wake up by 4. We just have 4 hours of sleep, and we continue the work again. That is not too good, because sleep deprivation can increase blood pressure. You find out that when you don't sleep well, when you wake up in the morning, you have a kind of headache. Why is it so? Because your blood pressure is building. And poor sleep can also bring about insulin resistance and other inflammatory events in the body. Now, in Nigerian studies, urban professionals with high stress and poor sleep have higher incidence of stroke and heart attack. Apart from this thing I've mentioned, we can classify them as modifiable factors because there are things we have the power, there are things we have the strength to control, so they are modifiable. And those are the things we are going to focus on. How can we modify this? Now that you have known, the awareness has been created that these factors are the ones that can trigger this acute medical emergency in our community, in our society. What should we do? Nevertheless, there are also other non-modifiable factors. For example, age. We all know the more you age, the more the body becomes weaker, and the more you are prone to other chronic diseases. For example, we talk about sex. Sex is another, gender of the person is another great factor. We find out that there's a higher risk of premature cardiovascular event, especially myocardial infarction among men. And among women, there's a higher risk of stroke at older age, most especially post-menopausal. And this is so because from all these conditions, prior to menopause, at a young age, it has a way of protecting the woman. But after menopause, you see that there is increased risk. The risk becomes higher to getting stroke, and so on and so forth. Genetic is also a non-modifiable disease. It's not what we can do. But then we should be aware. We should take audit of our family. We should ask our fathers. We should ask our mother, what disease runs in this family? Do we have hypertension in our family? Do we have diabetes in our family? That will give you an idea that if one too have suffered from those chance of runs in the family, even though you cannot control it, but when you are aware that this thing happens in my family, you have to withdraw yourself. You have to restrict yourself from exposing yourself to those factors that can aggravate it or make it come up earlier than necessary. Ethnicity is something we cannot also, we are black and we are black. And something a study have shown that hypertension is common among black. Even stroke, the black people have a greater risk of developing stroke than the risk factor for developing acute medical emergency. We look at the modifiable strategies. What are the strategies to control this acute medical emergency? Number one is blood pressure control. Now, gone are those days that we don't have access to blood pressure apparatus. Every person can have his own blood pressure apparatus. And you can get that from the Madeira automated blood pressure apparatus. If you want to buy the manual one, you can also get the manual one. Now, you need to check your blood pressure every day. In fact, at the age of 50 and above, there's nothing stopping you from checking your blood pressure in the morning before you go to work, and when you come back from work, you check it again. Or if you don't even check twice a day, you can check once a day. If you don't check once a day, make it a habit to check at least once in a week. Once in a week. If I ask, how many of us have checked our blood pressure in the last 1 week? You will see that the answer will be very, very poor. Why? Because we are carried away with activities. We are carried away with work. We are carried away with so many things. And since we are not having any sign, it doesn't really matter. We think we are strong. We think we are healthy. Remember, we said hypertension does not give any sign. So monitor your blood pressure. You can go to the pharmacy. You can go to the health center. You can go to the nurse. You can have your personal nurse that come to monitor your blood pressure, that come to monitor, give you counseling, and all that every day. Now, another thing that can increase your blood pressure is salt. You should limit your salt intake. There are so many condiments we put in our food that are salty. They are salty. You wonder why our grandparents don't suffer from the kind of condition we suffer from. Because during that time, some of these condiments are not available. And they make use of natural condiments. And those natural condiments, they are salty, but they also have high amount of omega-3 fatty acid. For example, the crayfish. It has high amount of omega-3 fatty acid, which is also a good cholesterol. We have good one and we have bad one. And that helps to reduce the clogging effect of the cholesterol in the body. Reduce alcohol consumption. It's very, very important. Studies have shown that proper BP control reduces stroke risk by up to 40% and heart attack risk within 1 to 2 years, which is very, very important. What about diabetes? Diabetes, that is blood glucose control. There are glucometers. We can afford glucometers. That for some of us that cannot afford glucometers, we can also go to different pharmacies or the clinic nearby us to check our blood glucose regularly. But it's something you can do. It's just a matter of being taught self-care management. When you are taught self-care management, you can monitor your blood sugar on your own. You don't need to be a nurse. You don't need to be a doctor. You can monitor it on your own. You can monitor your blood sugar on your own, which is very, very necessary. So try to make effort to monitor your blood sugar, because effective monitoring of blood sugar, if your blood sugar can be within normal level, it lowers the risk of stroke by 25%, and that is huge. That is huge. So you can go to workplace. For example, this institution, we have, I think when I was coming, I saw healthcare center. There's healthcare center here. There's nothing stopping you from walking to the healthcare center to check your blood glucose. It will not cost you that much to check your blood pressure. Even when you come to work, there's already a health center close to you that you can do that. It takes a conscious effort. It takes a conscious effort to do that. Then physical activities. Engage in physical activity. You can walk, you can cycle, you can ride, for a short trip. It's not every trip that you will be taking bike. It's not every trip that you'll be taking a drop. For example, this university has a very good landscape. Look at the landscape. When you drop by the gate, it's sloping. That can accelerate your movement. The effort might not be that much, and that is a form of exercise. Then as you are approaching this way, you are putting a little effort. But with small exertion, you'll be able to come to a flat land, and that 10 minutes exercise can go a long way. You can be deliberate about it, that anytime I'm coming to work, once in a week, I will stop at the gate. I will not take bike. I will walk down from the gate. Or you can do it on a daily basis. Depend on your strength. And you also need counseling. Because we also have people that engage in exercise that are more than their capacity, and that becomes a problem. So try as much as possible to involve in activities. It could be a healthy diet. I've talked about this, but I want to reiterate it. Healthy diet. We are suffering today because of the food we are eating. Our food is too much of cholesterol and salt. It's too much of cholesterol and salt. Now, this part of this country, I call them West. So when I mention West, I don't mean Oyibo land. I mean the Western state. Now, if you see the egusi, it's red. the oil must float to make it sweet. Then the melon will be at the bottom. Yes, it is very sweet, very, very tasty. Yes, but then you don't know what you are eating. Those are saturated fats, highly saturated fats. And that is what we are eating. And we will now use that saturated fat to eat 4-5 rams of fufu with a ring road, with roundabout, at a setting. And by the time we eat, we feel good when we are eating it. And when we finish eating it, we feel good. We tell ourselves, yes, we have eaten. We have eaten. But you don't know what we've just swallowed. Effect on our food. Have effect. When we don't do that, we go to the eatery. Eatery food are highly seasoned to make it sweet. A lot of butter. Butter is cholesterol. It's saturated cholesterol. A lot of butter to make it sweet. Whether you talk about cake, whether you talk about whatever, all those big things you talk about. Even biscuit. At our age, I don't think people should be patronizing biscuit. Biscuit should be left for the younger one, toddlers, because they are the ones that need glucose. They are the ones that brain, they are still growing. But at our age, we should limit the kind of biscuit. And the biscuit these days, they are too sweet. They are full of sugar. They are full of sugar. So watch what we eat. In those days, our grandparents sick today because they get their fish from the river. It's fresh fish. They don't even need to fry the fish. Fresh fish from the river. Go to the backyard, they have vegetables. They pick their vegetable and they make food. And you see them, they were living longer than we are doing these days because of globalization and some other things. Limit fried food and street snack. Limit fried food and street snack. Now, at our age, if we are to eat, the quantity of fufu we should eat, we should not be eating more than one. No, the wrap is very small now because of economy. One wrap is enough. Let the other portion of the food be vegetable and fruit. Let the other portion of the food be vegetable and fruit. And when you finish, you now drop it, for some of us, when we finish around the guinea worm and everything, we step it down with Coke. Or we step it down with Fanta. And you feel you are enjoying. To you, you are enjoying. Somebody is watching you and say, hey, I wish I can be like this person. But you don't know what the person is just gulping. It's gulping a lot of things in our body. But there should be caution. I just want to say this. There should be caution in the type of fruit we are eating these days. Because our fruit has been polluted. That is why you should take to the one you planted in your backyard. Or the one you think that comes from the community or from the village. Because some of our fruit have been genetically modified. Some of them are preserved with chemicals. And you see the rate at which cancer is growing. You see the rate. Because some of these chemicals generate free radicals in our body. And the causes of cancer, apart from genetic mutation, is the free radical. And where are we getting this free radical from? We get it from the food that we eat, especially the fruit. Even the chicken, the so-called chicken we call white meat, it's no longer white meat again. Because some of these chicken are genetically modified. And apart from being genetically modified, they also preserve them with some chemical. And those chemicals interact with our cell. And they cause mutation gradually. They cause mutation gradually. It's not a one-time effect. And before you know, if you don't suffer from it, you pass it on to your child. Because your gene has been mutated. And no, you cannot deposit it. You cannot So you see some people, they are not cancer. Their parents did not suffer from cancer, but they are having cancer. Why? It has been there. The gene that has been mutated has been passed on to the prodigy, to the child. And the child grows to manifest the evidence of that cancer. So when we are taking to fruit, we should be very, very cautious of the type of fruit we eat. Studies have also shown that following a diet rich in fruit, vegetable, and fiber reduce stroke risk by 20 to 30%. Now, this I have said, they are under our control. They are under our control. You can take deliberate effort to do that. But there are people that have been diagnosed of this condition. They already have diabetes. They already have stroke. Now, they have to adhere to what we call secondary prevention. And secondary prevention is aimed at preventing complication from this condition. So, at this particular point, you have to visit your physician regularly. You have to, if you can't consult the physician has prescribed your drugs for you, you can employ the services of the nurse, who will work with you to ensure that you adhere strictly to the prescription, who will also counsel you on the side effect, who will counsel you on the things you need to take or the things we don't need to take. Now, health is not cheap, just as education is not cheap. We need to, most time, invest money to make sure that we are healthy. So you take your drug, either antiplatelet drug, statins for cholesterol, and so on. Then there's nothing wrong if once in a while, every 6 months, you go to the clinic to check your heart, using the ECG, to look at the electrical activities of the heart, whether you are developing arrhythmia already, which is one of the shock causes of stroke. So make yourself available to do some of this checkup so that you can detect early if there is any abnormal sign and symptom, and you take proactive steps to solve those problems. The same thing I have said is also applicable to individuals suffering from heart attack. Your lifestyle is still very important. Your weight management is still very important. Smoke cessation is important. Taking drugs to lower your blood pressure and cholesterol, they are still very, very important. Now, preventing complication of chronic disease in Nigeria. Now, the second part of the lecture, we'll talk about chronic diseases. And one of the major chronic diseases are diabetics. And there are so many complications from diabetes, like I mentioned earlier. We have diabetic foot that can lead to amputation. We have diabetic retinopathy that can lead to blindness. We have diabetic nephropathy that can lead to kidney failure. All these are some major complications from diabetes. So in order to prevent this complication, you also need to engage in regular monitoring of your blood sugar. Apart from that, you inspect your feet daily. If you know you are diabetic, take it as a conscious effort to inspect your foot daily, to know whether there are cuts, to know whether there are sore. Because some diabetics develop cuts or sore without knowing, because the foot is not sensitive. The sugar has damaged the nerve ending. So when they hit themselves against any surface, they are not aware that they had an injury. Before you know, the injury will begin to grow, infection will enter, gangrene, and the rest of them. So take time to inspect your foot on a daily basis and wear protective footwear at home or outdoor. Then your eye, go for eye screening to know if there's any changes as a result of diabetes. And you can also look at taking your urine for kidney test, for kidney phosphorus test, both urine and blood, to see if there are changes in the electrolytes that indicate that the kidney is no longer functioning. Then as per chronic kidney disease, there is one mistake we made. You know, because we work, we are tired. The next thing is to take painkiller. And painkillers, some of them are addictive. Now, so we are so used to painkiller that when we come from work on daily basis, we must have to take painkiller before we can sleep. Apart from where it's helping to relieve the pain, however, majority of painkiller are nephrotoxic. And when we say nephrotoxic, they are drugs that are very dangerous to the kidney. And by the time we are used to it, it has a cumulative effect. And before you know, our kidney will be damaging and will come down with chronic kidney disease. Monitor electrolyte function. Check the potassium level. Check the sodium level. Check the creatinine level of the body. Because these are very key electrolytes that can signify kidney damage. They are very, very important. Then patient education and community support. This is also very important. Many NGOs will be organizing campaigns. They will be organizing seminars. They will be organizing so many workshops on self-management program. Please kindly make yourself available. It might be for fee, it might also be for free. For example, in churches, for example, in schools, they might be for free. But there are some that may be for fee. Try to make yourself available, where you will be taught some of the techniques, some of the tips on how to monitor your disease, how to adhere to your medication, the early complication from the disease. They are very, very important. Community is not also left out. The community is also good. There are peer groups. There are church-based health club, neighborhood health community that can also help in providing some of all this support for the individual. What are the community-based, as I round up, what are the community-based intervention for medical emergency and chronic disease prevention? One is health education campaign. And that is one thing this university is doing today. This being a public lecture or a faculty lecture, as the case may be, is also a forum of creating awareness to the community around. Here I know we have the community members, we have the academia, we have the student, we have the non-academic, and all this comprises of the community. The university itself is a community of its own. And organizing this forum is also a way of raising awareness about stroke, raising awareness about heart attack, and raising awareness about chronic disease warning. So that is one thing the university can do, or the community can do, health education campaign. And our Vice-Chancellor said it for all this forum, because there are so many things we will not get in the school, but such forum like this, they will make available for free. Then screening program is also very important. Screening program is also very important. Now, but if the university can do, it's not also bad. We can work to the health center to make basic screening. Like in my school, recently, they made it mandatory. The university organized a screening program for all academic and non-academic staff. And what are they monitoring? They take your blood pressure, you do your blood glucose. For if you are 50 years and above, they will take your blood for cholesterol. They take your BMI. If I tell you when the result comes out, you will not believe. All of us that are working day and night thinking that we are strong, our parameters are not good. Our parameters are not good because we have not taken time to check. That is when they discovered that some of them have even developed hypertension. And because it is early hypertension, it might not have any effect. But by the time the hypertension moves to heart failure, because there's what we call hypertensive heart failure, and gradually hypertension will move to heart failure. By the time you move to that way, you begin to feel unnecessary fatigue. You begin to feel you cannot climb the step again. By the time you go to the hospital, he said, "Madam, you have heart failure." But the question the doctor will ask you, "Did you have hypertension before?" You will say, "No." You say no. Do you know why you say no? Because you don't even know your blood pressure. And it has not, but nothing has warned you that your blood pressure is high. But you have blood pressure. Your blood pressure was high. And that increase in blood pressure continued to enlarge your heart. Continue to enlarge your heart to the extent that the wall of the heart is now becoming too thick that it can no longer contract. Heart failure has started developing. So that is what's called hypertensive heart failure. So that's why it's very important. Some lecturers, some non-academic staff, within that period discover that their blood sugar is high. And they have to go to the hospital for further screening. Some of them discover that their cholesterol is abnormally high. When your cholesterol is abnormally high, you feel unnecessary fatigue. You become easily tired. You will be falling sick easily because of cholesterol. Because of cholesterol. And any small thing you do, you become very weak because of cholesterol. And that opened the eyes of so many that have not taken the pain to go and do some screening. And from there, diagnosis has been made, and probably by the grace of God, they'll be able to follow up their health. That is why it is very, very important. So the university can follow suit. We can organize it for our staff, the non-academic and academic. You know, one thing with us, anything that is free is very, I don't know how to put it, but there's a word. We like free thing. So if you say go to the hospital because you know you're going to pay 5,000 naira, we will not want to go. But when you say it is free, everybody should come. Everybody will make themselves available. So it is also very important if we can toe that line. That thing will lead to early detection lifestyle modification, and medical referral as early as possible so that proper treatment can take place. Emergency response system is also very important. We should ensure we have access to emergency response system. We have response to AED, that is defibrillator, trained personnel. In case of sudden cardiac arrest, we can use the defibrillator around in the community as a first aid measure before we take the patient to the hospital. We also train our community member on BLOS. CPRO is also very important. Prompt action reduces cardiac arrest mortality by 30 to 40%. Policy is also very important. Policy. This might not be at our level because we are not, some of us are not policy makers, but we are close to people in policy. Policy to limit tobacco, policy to reduce alcohol or to increase alcohol taxation so that people can stop buying it is also very important. Policy that promotes healthy food. Our people are too selfish now. We don't even consider our neighbor. We only consider the gain we want to make from that particular sales. And two weeks, the ugu has matured. And you see the leaf very black. You see the leaf very black and large. And when you see it, it is very attractive. But do you know, some of them are breeded with car battery. Could you imagine? Just because we want to make money. And we are infusing more disease condition among ourselves. So policy could be made, and so that the food we are taking could be healthy enough. Just as it is done, we have SON that certifies some of the food that we eat. But we know this is Nigeria. We also have people that produce some of these things at the backyard, and they package it for us for one reason or the other. Now, the use of technology is very, very important. As we are sitting here, I know some of us have smartwatches. That smartwatch can count your heart, your pulse, that is your pulse rate. That smartwatch can measure your weight. That smartwatch can count the number of steps you have taken today. And it will tell you have taken too much number of steps. So that will caution you to rest. There are smartwatches. There are mobile app. There are SMS reminders that you can set to help you to adhere. So this is an era of technology, and technology has also made it very easy for us to monitor our health using some of these apps for early detection. We can buy into it. If we can afford some of this technology, it will be very, very good for us. Lastly, how do we recognize acute medical emergency? Let's take, for example, stroke. We use the word fast. What is fast? Fast means the face dropping. One side of the face drops. Or when the person is smiling, the smiling is not evil. Wash out. There might be a sign of stroke. Then arm weakness. Maybe one arm become weak. It's not able to raise one hand. Or the one arm drift towards and the other one raise. Wash it out. That might be sign of stroke. Then speech difficulty, slow or strange speech can also be a sign of stroke. So that is the time to call. That is the time to act immediately and get the person to the nearby facility. Then another one, the heart attack. What are the signs you can use to recognize heart attack? One is chest pain. You have a very sharp chest pain, not peppery chest pain. Peppery chest pain might be related to peptic ulcer. But you have a sharp pain that look as if, in addition to pressure, look as if somebody put stone inside your chest. And it is suffocating. You have shortness of breath. No, you are dizzy. You become suddenly fatigued. You are sweating. And also the pain radiates to your jaw, radiates to the shoulder, radiates to the left arm. All these are warning signs of imminent heart attack or cardiac arrest. So we must have to watch out for this sign and symptom. Conclusion: acute medical emergency such as stroke, heart attack, and complication of chronic diseases poses major challenge to individual, the family, and the healthcare system in Nigeria. Effective prevention and management require addressing both modifiable and non-modifiable risk factors, as well as overcoming community-level barriers. By promoting early recognition, timely response, and strengthening community-based intervention, the burden of these emergencies can be significantly reduced. Healthcare professionals play a critical role not only in clinical care, but also in education, advocacy, and
Thank you very much, sir. Our guest lecturer of today. I believe you still want to do more by celebrating the sacrifice that the guest lecturer has done us today by bringing up this particular lecture. And like the youth of this day will say, that somebody has shaken the table. I know the table. He has shaken the table, right? Am I speaking your mind? Our students, am I speaking your mind? Once again, a round of applause for our guest lecturer. So right about now, I know you've written some things. You have questions. You want to clear your doubts. You want to make remarks. You have some things. He has pricked your interest in some areas. So it is time for questions, and our guest lecturer is still very available to answer your questions. So if you have questions, kindly signify so that the microphone can be passed to you. 5 questions. 5 questions. Five questions. We're also welcoming questions from our faculty and staff. If you have questions, please. Okay, or comments, if you have comments. We've had 2, okay, please come forward. Come forward, come forward. Achievers are very confident. Please come, your name, your class, and your question. Your class and your question.
Good morning, sir. Good morning, Mr. Timothy. Thank you for your wonderful lecture. Thanks to the management for the organization of this program. Okay, my question. Okay, my name is Israel God's Favor. I'm in 400 level. My question is based on diet. I'm someone that is very conscious of what I eat. But in the environment where I find myself, even if someone is aspiring to be a vegetarian, it's not possible because of the environment I find myself. So a few days ago, I got fufu. And the swallow I ate, I just noticed that it was so salty. And I was asking myself, I could not find the melon. I don't know, it was so deep fried. And that really got me. So even apart from that, in the things we eat in school, it's not really healthy to me. And how do I manage that in this environment I find myself? We don't cook, we don't get fresh vegetables from the market. So what we are buying in school, how do I manage a healthy lifestyle? That's my question, sir.
Thank you very much. Don't just clap, ask your question. It's an opportunity for you to ask your questions, to make your comments, to clear your doubts. Do we have others? Please come.
Thank you, sir. I want to appreciate our able lecturer for the wonderful lecture. I'm Mrs. Michael Grace Olaoluwa, standing on the existing protocol. My question is, I just want to clarify this belief. Many people believe when we are telling them, don't take sugary something. Some people believe that when you take something that is sugary, after that, go and take something that contains bitter leaf. How do we justify that? Where is our stand? Do we believe in that? That's my question. Thank you.
Thank you very much, sir. My name is Omeshakin Adegboyega from Adaba FM. When I was in the university, I have a friend of blessed memory now, Promise. Promise died when he clocked 20 years. And I could remember then I was one of the people that fought for him when school authority decided to withdraw his admission due to his age then when we entered into the university. I was even one of the people that followed him to the hospital to do checkup and the likes like that. So we discovered that there were no chronic medical complications then. But it's quite unfortunate that immediately we graduated the following year, Promise died of heart attack. So, I want to ask this question. Given the challenge of healthcare access in many communities, what low-cost preventive strategies would you recommend for reducing acute medical emergencies among vulnerable populations? This is my first question. And the second question, sir, okay. The first one, all right. I said, given the challenges of healthcare access in many communities, what low-cost preventive strategies would you recommend for reducing acute medical emergencies among vulnerable population? So the second question is about pain reliever, sir. I think I'm guilty of that. My job, we traveled in the cold, the sun, and like so. Most times we have a very severe pain when we get back home, and what we end up using is pain reliever. At least tomorrow morning I will be outside again, going to where I do not know. So instead of using this pain reliever, you said it contributes to kidney disease, something like that. So what can we be doing, or what can we be using, if not pain reliever? Because I think this is a major challenge within we Nigerians. Thank you, sir.
Thank you so much. The microphone is going back to your speaker. Are we done? Okay.
Good day, sir. Standing on the existing protocol, thank you, guest lecturer, for today. I want to ask, what's the place of, you mentioned the high intake of carbonated drinks. So, and we're in an environment where we consume that a lot. After a stressful day, everybody feels once I take Coke, I will be refreshed. And the use of energy drink. So I want you to speak into that. Thank you.
Thank you very much for your questions. Okay. I invite the guest lecturer for his response.
Thank you very much for the questions. The first person asks, how do I manage healthy food in the school, considering the peculiarity of the school or the environment as it is? I guess you mean, from what we have said, the food you are buying here might not really meet the adequate diet, let me use that word, that is required of you. And you don't have any choice because you are here. Maybe you don't have any other means to get a better food. Well, I know it's a challenge. It's a challenge. But I don't know whether the school has provision for you cooking your food. And that is also good, because that will also waste your time. That will waste your time. That is also good. Hello? That is also good, because it wastes your time. You go to the market, you come back, you do this, and this is achiever for you. I know achiever very well. They are academic conscious, because they want to produce the best brain. So, the school management can come in. That is where we talk about policy. The last part we talked about, we said policy. Policy can be made to those people that provide our student food to ensure that the food they are providing are healthy enough for the student, considering what they are using to make the food. I think that can be solved with policy issue. I don't know if I answer your question. That can be solved with policy issue. Then the second one, believe that taking sugar and balancing it with bitter leaf. Okay, how does it work, or what is our take on it? Well, there is this belief that bitter leaf reduces the sugar concentration in the body. But I don't know how it works. Maybe can subject that to another critical analysis, to look at the ingredients in bitter leaf, whether it has similarity with insulin, or it has some chemicals or properties that can help drive insulin into the cells, which will not reduce the sugar level. But most of these beliefs are unfounded anyway. So some people will just feel it works. But definitely it's not work, because there is no experiment that have been carried out, except there are validated experiments that say that bitter leaf reduces blood sugar. You know, sugar is sweet, bitter leaf is bitter. So they want to use sense to say, if you take the one that is sugary, by the time you add the one that is bitter, it balances it. So the sweetness so it's just a common cultural belief, which I don't know, but we can table it down for experimental work to show the ingredients in bitter leaf. I know bitter leaf is very medicinal. I know it's medicinal. But with regard to reducing sugar, I won't tell you I know so much about it. But I feel it's just a common belief, and people felt it worked. Even my mom always will tell you that when he takes anything that contains bitter cola, he will start to feel weak. And the explanation to it will tell you that my sugar level has gone down. That is why she is feeling weak. And I say, okay, so what do you want now? They should go and buy a Coke or buy... Those are beliefs. But are they be validated? We are not permitted to speak on things that are not validated in an academic forum. Academic forum belief are jettisoned in most cases. You always speak on empirical, validated document. Then, given the current healthcare access in many communities, which low cost will be recommended for reducing acute medical emergency. Now, from the lecture, if you look at the lecture note, one of the problems with acute medical emergency is this issue of access to healthcare. It's a big issue. Some of the case scenario I use, the person would have gone up to the hospital, but there was no transportation. That reduces the time. Our roads are not good. We don't have some of these facilities in our community. That also boils down to one policy issue, making some of these healthcare centers available in every of our community. That is one. That is a policy issue. That is not an individual issue. But the one that has to do with the individual is Awareness of this condition. Being aware. Being aware that, I'm feeling this symptom, I'm feeling that symptom. And this could be this. Let me early enough make provision to visit the health center. Or better still, like I said, you can also have a personal physician, you can have a personal doctor that can come to your house, that you are paid if you have the money. I say health is not cheap. Why most of the time people die, they died out of lack of money to purchase health. Let me use that word. So you can have a nurse that regularly check on you, counsel you, advise you on what to do, and also observe you, teach you some of those symptoms. Those are cost-effective enough. Maybe once in a week or once in a month. Now that person will have a contact with you. You can be sending the person message. Now the era of telemedicine is even making it better. But now we are talking in the village. But some of these telemedicine can also work in the village. Because almost some of us now have smartphone, at least Android phone, that you can chat on phone. You tell the person and communication is going on even while you are at home. And if there are any need for referral, the person will be able to do that. I think one of the, apart from policy issue that has to make those things available and accessible in the community, the individual can make a deliberate effort. And those deliberate efforts is availing himself or herself to programs that will educate him or her on self-care management, which I also talked about, or getting a healthcare professional that oversees his or her health, just as we have personal lawyers and so on and so forth. And so that can go a long way in helping us to identify early enough some of those signs and symptoms, and we take quick step to make sure that they are put in order. What can be used in place of pain relief? Yes, I'm not really saying that you should not take pain relief. But what I'm saying is that people have become addicted to pain relief. And the more you are addicted to pain relief, the more you want to go higher. Now, that is sufficient for you again. So you move to ibuprofen. To get to a time ibuprofen will not be sufficient to you again, you move to diclofenac. To get to a time diclofenac will not be sufficient for you again, you move to tramadol. And you know tramadol has been banned. It's under drug that are strictly controlled. And by the time you take tramadol, you think you are on top of the world. Because all those pain you are complaining that Panadol, the rest could not, you just be like as if you are a newborn baby. And you say, hey, so this drug they exist, they do like this. So you continue. And you become addicted to it. So the addiction is what is bad. It's not something you should be taking regularly. Even paracetamol, as low, or let me use the word low in quote, as paracetamol. Do you know paracetamol causes liver cirrhosis? Paracetamol is one of the causes of liver problem. But that is what we take every day like water. So in fact, every drug is a chemical. Every drug is a chemical. It's a chemical substance. It has its own adverse effects. It's just that you are taking it because the positive effect you are looking for is more at that particular time than the negative effect. So everything should be done in moderation. Try as much as possible to also give yourself time to rest. Rest can fix some of this pain. Adequate rest can fix some of this pain. Exercise can fix some of this pain. In fact, there are no medical method of treating pain. Pain is not always subjected to pharmacological method. There are non-pharmacological methods of treating pain. So you can also adopt some of these non-pharmacological methods, like relaxation, imagery, techniques, and so many other non-pharmacological methods. Why it is good that you are taking it to relieve pain, also be cautious because you can be so addicted To the extent that even when you are not feeling the pain, you want to take it because you feel like you just done some work and you want to take it. And by the time you stop taking it, you know the physiological response of addiction that will come with it. So everything should be done with caution and with moderation. Then the last one is carbonated drinks and use of energy drinks. Carbonated drinks are sodas, Fanta, Coke, and all the rest. And we have energy drinks. In fact, too much of everything is bad. Too much of everything is bad. In as much as you are thirsty, you want to question taste, you want to feel relief because you are hungry. And by the time you take that carbonated drink, the substance inside will make you feel. And that fullness, you feel you are now okay. Those are just temporary. Give it a time, it will wear off. And you want another one again. And the more you are taking it, the more you are giving your pancreas work to be driving those glucose, either storing them as glycogen or driving them into the cell. So when you too much give a particular thing too much of work, just as when you give the heart too much of work, what happens? It collapses and you say cardiac arrest. So that is also how it is. Everything should be done in moderation. But like I see it, for me, as a policy. As an adult, moderate your use of carbonated drink. Moderate it. You can take maybe two in a week. It's not every day you be because you see it. It's not water. Water can refresh you in as much as those carbonated drinks. Now, it is not the sweetness. We are carried away by the feeling we have. But we don't look at the medical issue that may arise from it. As much as it is good, it has its own adverse effect. You can take water. Cultivate habit of drinking water. When you wake up in the morning, drink water. I don't used to drink water. I'm kind of very bad in drinking water. Until I eat, I don't drink water. I can stay throughout the day. If I did not eat, I won't drink water. Because I believe you don't drink water on empty stomach, that it will cause me stomach pain. Until I call myself to order. If I woke up now, I can drink water and stay throughout the day without eating. But those things now does not really mean anything because I'm not becoming self-conscious of my health. That self-awareness is very important. It's not about the feeling, the self-awareness. So when you give me Coke now, I just, when you give me, I appreciate water than anything now. That I can drink water without eating. This morning I woke up, I took water. And I feel refreshed. I feel strong. I say, this thing work. At times you can make it warm. Warm water. When you wake up, you drink warm water. You see how you will feel. And those things help to flush your system. It flushes your system and you go to urinate. Do you know the thing that is washing out from your body? It's washing so many things. Even free radical is washing them away. And your body will be, you have that vitality. So it's not as if you should not take, but please do it in moderation. Energy drink, I don't subscribe to it. Because I know energy drink has some caffeine, or they are caffeinated, and it's additive as well. It's additive. Anything that has caffeine can raise blood pressure because it stimulates the sympathetic nervous system. It will keep you awake. Some of my students will say they are drinking bullet. I say, why are you drinking bullet? He say they use it to read. I say, really? Use it to read. He say, does it work? He said, it works. It made them to stay awake. And when you stay awake, poor sleep will increase the sympathetic nervous system. It will raise your catecholamine. Your catecholamine will increase the level of cortisol. And that will lead to resistance to insulin. So diabetics is gradually setting in. It's not the immediate. What we are saying might not happen tomorrow, might not happen next tomorrow, but it has a cumulative effect. Thank you.
Thank you so much, sir. Our guest lecturer, Dr. Timothy Ehwarieme. Once again, a round of applause for him. Students, I hope the table has been fixed. Has it fixed the table? Thank you very much. At this juncture, I'll be calling to the microphone for the presentation of the faculty, the acting dean, Dr. Abiodun.
I want to call on the Pro-Chancellor to help us do the presentation. Dr. Ayeni.
The guest lecturer, Dr. Timothy A. Ehwarieme. Did I pronounce it very well? In recognition of your distinguished scholarly presentation titled Preventing Acute Medical Emergencies in the Community, Strategies for Reducing Stroke, Heart Attack, and Chronic Disease Complication, at the first public lecture of the Faculty of Nursing Science at Chivas Vestowo. Your contributions has enriched academic discourse and promoted excellence in professional practice this day. Please accept this as a token that you visit the best university in Africa. Thank you. Congratulations.
Thank you, sir. Thank you, sir.
Thank you. Right now, I'll be inviting the Pro-Chancellor to the microphone. You know that he has a special, he's always having something special for the Faculty of Nursing.
The acting Vice-Chancellor, all the frontline officers of the university are present, the guest lecturer, faculty members, distinguished students of the faculty, members of the press. It is my pleasure to be here, to be part of this epoch-making occasion, the maiden lecture of the Faculty of Law. And I think this is 5 marks, Abi, on the board. The 5 marks are well deserved. You can see struggle not to come out in the negative. I understand that you have only 130 students, 129 students, and it is 3 marks lost by each student on the rating board. And if you have minus, they may carry the minus over. Carry over. Well, let me commend and appreciate the faculty for adding to our academic discourse. It is very significant. Today, everybody here present will have learned one thing or the other. And learning and education is so important, not only for the community, first for yourself. For yourself. I have an in-law who woke up in the morning and felt headache, and he is battling with high blood pressure. He didn't sleep well, but he said, when I come back from court, I will go to hospital. And he had stroke because of negligence. It was not a mild stroke, devastating one. Devastating one. But that morning, if he had been part of this lecture, he won't differ. He will know that his health is more important than being a spectator in a courtroom. Even if he were to give evidence, he first has to take care of himself. If he gets to court, they can take an adjournment. The man who is to give evidence in this place has gone to hospital. Maximum adjournment. He was not going there to give evidence. He's going to go there to wash. And chose to go and watch proceedings, and he had stroke. Devastating one. He has not died, but there's something, he's permanently dependent. Take breakfast, do exercise around the house, watch television for the rest of his life. So, education is key in these lectures. All faculties must organize at least one. It's different to inaugural lecture. It's different. We must create one day in an academic session to invite an egghead like today to impart knowledge. It's different to what we learn in classes. It is on this note I want to commend the lecturer who has done exceedingly very well. And I've told him that in this place, when I see a good material, what do? We kidnap. We kidnap him to come. Are we too many in your department? So he has assured me that he will join us as a lecturer in the Faculty of Nursing Science. Are you clapping for him? Let me add this to the lecture. You are what you eat. Tell your neighbor, you are what you eat. It may be funny if you see a man who appears to deliver, to get ready to deliver a baby tomorrow morning, ask about what he's eating. If you see a healthy man, ask about what he's eating. Whatever you eat determines your health and your lifespan. Be careful about what you eat in managing all these health challenges. I had that one to what the lecturer has said. And as a corollary to that, please love yourself. Before you love your neighbor, your husband, your parents, love yourself and be careful about your health and what you eat. About my health and what I eat. The lecturer spoke about taking, Coke and all that. But it's also a medicine for some people. Abi? A bottle of Coke, if you have hypoglycemia, Abi, what do you call it? And some people will have a bottle of Coke by their bed. I don't say Pro-Chancellor. A bottle of Coke. When the crisis comes, you save yourself by first taking that bottle of Coke. It's also a medicine for some people, but it is heresy for some people. So know your body chemistry. Know what you want so that you can live long. I want to appreciate all of you. I'm not moving vote of thanks. I want to appreciate all of you, the faculty organizing committee, for organizing a well-attended lecture. A well-attended lecture. Whenever before the event, get across to the director of works, because nursing science department are not too many. Abi? They are not even enough, but you need more chairs. God bless you all.
Thank you so much, the Pro-Chancellor. At this juncture, I'll be inviting the Chairman Organizing Committee for this maiden lecture, Dr. Bamidele Ayeni, for the vote of thanks.
I stand here today to express my appreciation to the monuments, especially the chairman, the Pro-Chancellor and chairman of the Governing Council, in person of Professor Bode Ayorinde. Thank you, sir. Let me appreciate the acting Vice-Chancellor, Professor Aremu, for gracing this occasion. My appreciation goes to the deans of various faculties, the provost of School of Postgraduate Studies, Provost College of Medicine in absentia, and all other faculty members here present today. I appreciate you profoundly. I equally want to appreciate faculty members from nursing science for staging this particular event, the Maiden edition, which amplified that we are breaking the jinx, which has been keeping us from having faculty lecture since inception of the faculty. I believe that before the end of the year, we are still going to have one more lecture by God's grace. Once again, sir, I will not leave you without saying this. We thank you for your support, sir, all the time. We thank you, sir. We thank you greatly. My appreciation goes to the guest lecturer for doing a yeoman's job. By the time we look at the content of the discourse, we can see that he has been able to look, which we can term as having high morbidity and high mortality rates in Nigeria. Hypertension is very, when you look at the prevalence, is very high. When you look at diabetes, it's very high. By the time some people, probably when they die, they may say it's as a result of maybe being attacked by witches or witchcraft, without knowing that there are a lot of problems that these people are having. I believe that he has done justice to it. We appreciate you greatly, sir. Thank you, sir. I want to appreciate the members of the fourth frame of estates. We are talking about media men and women that are here. We appreciate you. We appreciate the ICT who are streaming this program live for others that cannot join us here physically to be able to watch this program. I equally thank those people who are online, who are listening to this program, who are in tune with what we are saying. I appreciate all the nursing students and students from other faculties. I appreciate members of the academic and non-academics who are here present, and my belief is that you have been able to add more to your knowledge today. And your take-home today is that remember that you have one life to live. You need to visit hospital, clinics, to have medical checkup regularly. I pray that we have not died suddenly. Thank you for listening. We appreciate you. Thank you.
Thank you very much. For the Acting Vice-Chancellor, sir, we have come to the end of this program, and I'll be inviting the bossa. Oh, sorry. Pardon me. I've already informed the Dean, Faculty of Faculty of Engineering and Technology, Professor Onoumi. Okay. Can we listen to this announcement? the 2026 World Menstrual Hygiene Day, and this program titled Flow and Focus, Navigating Menstrual. You have a lot. I will ask us to rise as we take the closing prayer, then followed by the university anthem and national anthem.
Let us pray. Father, Lord, we thank you for today. Thank you for the lecture. Father, we appreciate you, God, for the impact that have been made in the heart of the listeners, the hearers of this lecture. Thank you, God, for making these days a reality. We appreciate you. Father, take all the glory in Jesus' mighty name. Thank you for our Pro-Chancellor and the Chairman of Council. Thank you for our Acting Vice-Chancellor and the management. Thank you for all the academic staffs and the non-academics. We appreciate you for the impact that this university is making, even to the community. Be exalted, Lord, in the name of Jesus. And for the lecturer, we thank you for his life. Thank you for the knowledge he has impacted. Thank you, God, because he has exposed so many things that has to do with our health, even to us. We ask, oh God, that you will continue to be with him and bless him indeed in the name of Jesus Christ. And those things you have learned, oh God, we pray, oh God, that you grant us that heart to do, even as instructed, as advised in the name of Jesus Christ. As we go from here to our various other activities of the day, Father, please be with us in Jesus' mighty name. Continue to guide us, guide announced. We say, Lord, is our business.
Thank you. We'll be having a group photograph. A group photograph down here. The Pro-Chancellor, the Acting Vice-Chancellor, our guest lecturer, principal officers, our deans, members of the academic